Great. So if anyone wants to view it afterwards, we'll also upload this recording on YouTube. Okay. Now going ahead with what are we going to cover in this session? Okay. So there are fundamentally two type of diabetes. वैसे और भी type of diabetes होती हैं, but ज़्यादातर दो type की सबसे common है, type 1, type 2. I'll explain that. How it develops, क्या signs हैं, क्या symptoms हैं उसके. Conventionally, like as of now, how are we treating diabetes? Okay, what are the steps that are being taken by the medical industry as of now to treat that? What is the alternative approach that we would like to recommend everyone? What is the alternative way that we would want to educate everyone कि diabetes आप ऐसे भी solve कर सकते हो? This is a more sustainable, this is a more better way to ensure that you are able to get rid of your lifestyle disorder, right? We would want to explain you what is the root cause. Okay, we would want to enable you to understand कि दिक्कत कहाँ पे हो रही है exactly. Okay, then we want to show that we are not just talking theory. This works in real. Like how are we treating the root cause? What are the case studies? कुछ case studies भी आपको बताएंगे. And like how do we, like what are the next steps? Okay, and then like as I said, Q&A is the one. We really want to take up your questions. We really want you to ask a lot of questions. How अच्छे से like be satisfied with whatever questions you have, right? So before we really start, I would want to just highlight that the chronic conditions in India. What is a chronic disease? Chronic disease is the one in which the symptoms last over a period of time. Okay, 3 months से ज़्यादा अगर symptoms last होते हैं, it is called a chronic condition. There are two type of things. One is infection, जहाँ पे आपको एकदम से infection, you go to the hospital and it is solved. Second is a chronic condition where the symptoms last for more than 3 months. So diabetes is a chronic condition. There are a lot of chronic conditions prevailing in India as of now and prevailing throughout the globe. Diabetes, PCOS, thyroid, gut issues. Today we are going to focus on diabetes. Today our primary focus is to enable everyone to understand what is diabetes, okay, and how it develops and what are the solutions that can be taken. Starting with the base, there are three types of diabetes. Type 1 is autoimmune destruction of your beta cells. मतलब आपको अगर type 1 diabetes है, usually आपको बचपन से होगी, childhood से होगी. We won't deep dive on type 1 diabetes as of now because that is not extremely prevalent. Only 5 to 10% of the people actually suffer from type 1 diabetes. The major diabetes, the major metabolic disorder is type 2 diabetes. Type 2 diabetes is the major chronic disorder. A lot of people are suffering from type 2 diabetes, which is elevation in your blood glucose levels. आपका blood glucose high रहता है हमेशा. Your HbA1c levels are higher. उस पे हम deep dive करेंगे आज. Third is gestational diabetes. Usually pregnancy के time होता है. We also have solution for gestational and type 2, but majority 90% people are suffering from type 2. So applying the Pareto principle, we would want to deep dive on type 2 diabetes. What is type 2 diabetes? Okay, how it is solved and the root cause. Okay, so listen very carefully, guys. Just next 30 minutes, and trust me, you will understand in and out of things. So before we deep dive into diabetes, let's understand what is metabolism, because diabetes is said to be a metabolic disorder. What is a metabolic disorder? उससे पहले we need to understand what is metabolism. What basically metabolism means. Metabolism means you eat something, it gets processed, and that process leads to formation of energy in the body. That is basically your metabolism. Okay, now consider a scenario that you eat food. Okay, this is the ideal case scenario. A ideal functioning metabolism. There is, the person is absolutely fit, the person is absolutely healthy. You eat food, the food that you eat breaks down into sugars. The sugars that break down in your body, they are absorbed in the blood. Once they're absorbed in the blood, जो आपने sugar खाई, आपका blood में जो glucose level है, जो sugar level है, वो ऊपर उठ गया, वो elevate हो गया. तो blood sugar level आपका elevate हो गया. जब आपका blood sugar level elevate हुआ, आपके hypothalamus ने आपके pancreas को एक सिग्नल दिया, एक इंडिकेटर दिया that you need to produce insulin. आपका pancreas insulin produce करता है. जो आपका insulin होता है, वो आपके cells के साथ bind करता है, और वो जो blood है, वो that gets transported into your muscle cells and the liver. I'll repeat this flow once again. This is very, very important to understand. You eat food, the food that you eat breaks down, digestion हुआ. जैसे ही वो food breakdown हुआ, आपका glucose level बढ़ा, blood glucose level बढ़ा, तो आपके hypothalamus ने pancreas को indication दिया that you need to produce insulin. Insulin will bring that blood glucose down. Insulin will bind. It will carry that blood glucose to your liver and your muscle cells. This is how an ideal functioning of a metabolism looks like. Now, once that blood glucose is transported into your liver and your muscle cells, तो liver हमारा एक ऐसा organ है that can store glucose in the form of glycogen. There is only one organ in the entire human body that can convert glucose to glycogen and glycogen back into glucose. Okay, so some part of that sugar is stored in your liver, and बाकी क्या होता है? Insulin binds to the cell. Insulin is the key that opens up your cell. आपका cell open होता है. Insulin is basically the key. It opens up your cell and sugar enter, और वहां से आपकी energy produce होती है cell के अंदर. So insulin is the key that opens up your cell. The sugar enters your cell cytoplasm, और वहां से आपकी energy produce होती है, ATP production होता है. This is how the ideal metabolism works. थोड़ा थोड़ा understanding हुआ होगा. I'll again iterate this once, okay, but in a simpler example, okay. So होता क्या है, जैसे आपका ये this is your cell, okay. This where if you are able to see my mouse pointer, this is your cell. So insulin comes. There is an insulin receptor in your cell. Insulin plugs into that receptor. Your glucose channel opens up. The glucose enters into that, and your cell produces energy. ऐसे एनर्जी प्रोड्यूस होती है एक आइडियल मेटाबॉलिज्म में. आई होप एवरीवन अंडरस्टूड. आपने चीनी खाई, आपने चीनी मतलब मिठाई नहीं होती सिर्फ. शुगर्स आर योर राइस, रोटी, पास्ताज, चॉकलेट्स, चिप्स, कोक, एनीथिंग. ग्लूकोज इज द प्राइमरी फॉर्म ऑफ एनर्जी. आपने खाया, वो सेल के अंदर जाता है शुगर, वहां पे एनर्जी प्रोडक्शन होता है, एंड यू गेट एनर्जी फॉर योर बॉडी टू फंक्शन. दिस इज हाउ आइडियल मेटाबॉलिज्म वर्क्स. Now, what happens in diabetes? When we say diabetes is a metabolic disorder, what does that metabolic disorder mean? That metabolic disorder basically means आप खाना खा रहे हो, आपका blood sugar level बढ़ रहा है, your pancreas is giving a signal, your hypothalamus is giving a signal to your pancreas to produce insulin. आपका pancreas ने insulin बनाया, but that insulin is not binding. Your cells are insulin resistant. That is the root cause of diabetes. Your cells are insulin resistant. The cell is not opening up to the sugar. क्योंकि सेल ओपन अप नहीं हो रहा है शुगर को एब्जॉर्ब करने के लिए, शुगर एब्जॉर्ब नहीं हो रही है, there is no energy production. Since there is no energy production, all the sugars that you are taking are fundamentally getting converted into fat. That is why obesity is a prevailing symptom of anyone who's on the verge of getting diabetic. You start to get obese because जो आप शुगर खा रहे हो उसकी एनर्जी नहीं बन रही है. दैट इज नॉट गेटिंग यूज्ड अप. एनर्जी इज नॉट गेटिंग फॉर्म्ड. एनर्जी नहीं बन रही है. हेंस सिंस एनर्जी नहीं बन रही, यू फील टायर्ड. Since you feel tired, the body again gives a signal that the body, I am tired, I need to eat food. Then you again eat food, and this is a vicious cycle. And because of insulin resistance, people who are suffering from diabetes are stuck in this vicious cycle. And that is the root cause, and that is what we want to solve. We want to take people out of the vicious cycle. Okay, we want कि जो आप खाना खा रहे हो उसकी एनर्जी बने, जो आप खाना खा रहे हो वो फैट में ना जाए. You are able to use up that same food to generate energy. Hence, we want to solve for insulin resistance. I hope I am clear. I'll wait for a yes no coming on the chat, because this is the base of diabetes. This is the base of diabetes, insulin resistance. It's important that everyone understands the phenomena of insulin resistance. Everyone understands that what is this metabolic syndrome? What is this chronic condition? Great. Wonderful. Okay, now, so what are the symptoms of diabetes? Symptoms like generally हमें बोलते हैं कि these are the symptoms that people tend to suffer from. ये symptoms हो जाएंगे when you are suffering from diabetes. But let's also understand why are we getting those symptoms. First is increased hunger. As I explained, the food that you are eating is not the glucose that you are eating, that is not entering the cell. There is no energy production, so you're always tired. So body is asking for more food, so you will feel very much hungry. आपको खाना बहुत ज़्यादा आपको प्यास लगेगी, बहुत ज़्यादा भूख लगेगी. Second thing is frequent urination. Now, this is a very interesting concept. Why anyone who's suffering from diabetes will also suffer from frequent urination? I'll explain in very simple language. See, the filtration of our blood in the body happens in the kidney. Kidney के अंदर होती है सारी filtration. सारा filtration आपका kidney के अंदर होता है. तो अगर आपका blood glucose level हमेशा high है, तो kidney क्या करेगा? Kidney has to purify the blood. It has to bring the glucose levels down. So it will start to release the glucose via urine. And since the blood glucose is high, the filtration process will increase. Filtration will increase. Hence, you will have to urinate more frequently. Okay, so that is why frequent urination is also a symptoms of diabetes. You will be low on energy. आप खा तो बहुत रहे होगे, आप बहुत भूख लग रही होगी, आप बहुत ज्यादा खा रहे होगे, आपको बार बार खाना पड़ेगा दिन में, हो सकता है आफ्टर एवरी 5-6 hours, तो बहुत ज्यादा बोल रहा हूँ, every 2-3 hours you have to eat food, but still you will be low on energy because your glucose metabolism is poor. Because of poor glucose metabolism, we tend to feel low on energy. Blurred vision is a slightly later stage where a layer of glucose tends to develop around our eyes, and that leads to blurred vision. Increased thirst. If you urinate more frequently, thirst, तो प्यास तो लगेगी ना, आप ज्यादा पानी बाहर निकालोगे तो पानी कहीं ना कहीं से जाएगा ना अंदर. So these are the symptoms of diabetes. Now, if you are suffering from any of these symptoms, that does not really imply that you are a diabetic. What we are trying to say, these are indicators. How can we assure that one is diabetic? That is via blood test. उस पे भी आएंगे. But I hope that you understood those symptoms and how are they related to insulin resistance. That is very important. That is very, very important to understand, that we really are able to form the link between insulin resistance and these symptoms. अगर ये समझ आएगा तो उसके बाद what is our approach आप खुद ही गेज कर लोगे. Usually starting में हम इतना serious नहीं लेते. Whenever we get a chronic condition, we are not very serious. But I just also want to tell you that what happens if we do not take timely actions. Okay, जैसे हो सकता है आपको कुछ major कोई basic symptom, आपको you might be suffering from one basic symptom, but you tend to just ignore it, right? अभी सिर्फ ऐसा है कि frequent urination हो रहा है या फिर थोड़ा weight gain हो रहा है, but हमने बोला चलो यार relax मारते हैं, chill मारते हैं, कुछ नहीं होएगा, अपने आप सही हो जाएगा. But वो अपने आप सही नहीं होगा. वो क्या होगा? It will lead to further comorbidities. You will tend to gain weight. You will tend to develop multi-system dysfunctions. Might suffer from high BP, might suffer from cholesterol, might suffer from hormonal imbalances. A lot of people who are diabetic also suffer from thyroid disorders, because when the insulin levels in the body are high, your T4 hormone also starts to mimic that. तो आपको बाकी hormonal issues में start हो जाएंगे, right? And even at that point of time, if you don't treat, then it leads to major issues. Those are your macro and microvascular complications, where our kidney, liver, vision, all of these things start to get involved. Okay, and वहाँ पे उस time पे there might be a coming back, but there might be no coming back. Okay, so we want to focus on preventive healthcare. We are telling you, we are trying to put in so much energy, we are trying to explain you this so that you can take a timely action, so that when the changes in our body are irreversible, उस time पे we do not repent. Okay, so if we have any of these symptoms, or if our blood report shows that yes, we are in the diabetic range, which I'll come to, we should take timely actions. Okay, so let us talk about the conventional approach. I would want to come to that, but I feel that let me explain, like, when does a person is really diabetic, right? So I'll just talk about the blood report part first. Okay, HbA1c is your average glucose level of 3 months. It's the 3-month average glucose level, that is your HbA1c. If this range is more than 5.7, you are in a pre-diabetic range. If this range exceeds 6, you are in a diabetic range. Fasting glucose. If your fasting glucose is higher than 90, okay, so there is a standard range that you'll see on blood reports, and there is an optimal range. If your fasting glucose levels is higher than 90, it's a red signal. If your random glucose levels is more than 120, it's a red signal. If you're fasting insulin test is not recommended, but it is highly recommended. Fasting insulin test is really important to gauge whether a person is suffering from diabetes, because when your cells are insulin resistant, your pancreas will produce more insulin, ज़्यादा insulin produce करेगा, so that आपके cells absorb कर पाएं insulin को, आपके glucose को absorb कर पाएं. एक मैं थोड़ा सा एनालॉजी देता हूँ इस पे ताकि सब लोगों को समझ आए ये चीज। जनरली क्या होता है, जब हमारे घर में जब बच्चे सुनते नहीं एक बार में, तो उनको प्यार से बोलते हैं, एक और बार प्यार से बोलते हैं, फिर तीसरी बार हम चिल्लाते हैं तब वो सुनते हैं। तो हमारी बॉडी में भी कहीं ना कोई सिमिलर टाइप ऑफ पैटर्न ही रेप्लिकेट होता है। तो जब पैनक्रियाज थोड़ा इंसुलिन देगा तो सेल नहीं खुलेगा, वापस थोड़ा और देगा तो तब भी सेल नहीं खुलेगा, फिर वो झटके से बहुत इंसुलिन देगा, and that is when your insulin levels will be really high, then the cells will open up, right? That is fasting insulin. So if your fasting insulin is greater than 10, it's a red signal. Okay, so these are the parameters. These are your parameters that can help you understand whether you are whether you are in a diabetic range, or you have a or you have a chance of developing diabetes, right? So these are the biomarkers that you need to really understand. Right? Don't go with standard ranges. Go with optimal ranges. Functional medicine always works on optimal ranges. Okay, always look for optimal ranges. If you want, all of you can take a screenshot of this slide so that you understand what's the optimal range. Optimal range में operate करोगे तो you will be like, that's the true form of preventive healthcare, to be in the optimal range. Okay, now coming back where we left. Now conventional approach क्या होता है? मान लो आपको you are diagnosed with diabetes, right? क्या होगा? आपको बोलेंगे यार ये मेटफॉर्मिन खा लो. You'll go to a doctor and he'll give you metformin. Nothing against metformin, nothing against the medical practices. What we are trying to say that there is a better approach available. Okay, that is one approach. There is a functional approach. तो होता क्या है, metformin is basically a tablet that improves your insulin sensitivity. इंसुलिन सेंसिटिविटी का मतलब क्या होता है? आपके पैनक्रियास को ज्यादा इंसुलिन नहीं प्रोड्यूस करना पड़ेगा, आपके सेल की इंसुलिन सेंसिटिविटी इंप्रूव हो जाएगी, जो ग्लूकोज मॉलिक्यूल, जो ग्लूकोज आपके सेल के बाहर है, वो डिफ्यूज कर जाएगा, तो एनर्जी प्रोडक्शन हो जाएगी. तो मेटफॉर्मिन खा के आपको लगता है डायबिटीज सही हो गया है, बट नहीं, यू आर स्टिल इन द विशियस साइकिल. इंसुलिन सेंसिटिविटी भी एक पॉइंट ऑफ टाइम तक ही आप इंक्रीज कर सकते हो. आपको डोजेज इंक्रीज करता रहना पड़ेगा अपना. यू स्टार्ट विद 500, देन यू गो टू 1000, देन यू गो टू 2000, उसके बाद यू स्टार्ट विद इंसुलिन इंजेक्शंस. So even if you feel that yes, you are treating the problem, no, you're not treating the problem, you are suppressing the symptoms. There is a difference between treating the problem and suppressing the symptoms. Here, what is fundamentally happening, if you are taking metformin for a longer period of time, it also leads to development of carcinogens in the body. There is a report, there is a news article where if people are exposed to metformin drug for a longer period of time, it also leads to development of cancers. It's a carcinogen. And there is not one study, there are multiple studies. So if you feel कि metformin खा के life जिंगल वाला है, तो वो सही में जिंगल वाला हो सकती है. Okay, if timely actions are not taken. So it is important to really understand that metformin is suppressing the symptoms. It's not treating the root cause. Second thing is insulin therapy. Some days back, I read an article where they said that insulin is the biggest scam of the 21st century. I won't completely agree to that, but yes, I would agree to that to some extent. Insulin is given to people when the beta cells that are responsible for insulin production in the pancreas, those have stopped functioning. Okay, it's not that beta cells, you will find a lot of articles where they say beta cells get killed, but it's not that beta cells get killed, beta cells get clogged. So when beta cells get clogged, it leads to your doctor recommending you an external insulin. आपको बाहर से इंसुलिन देते हैं so that your cells are able to absorb the glucose and your blood sugar levels can be controlled. So insulin therapy is the second method. Sulfonylureas आपके पैनक्रियास को और निचोड़ेंगे ताकि वो इंसुलिन बनाए. आसान भाषा में, weight loss surgery, bariatric surgery, not recommended, but some people have to go for it if the comorbidities are really high. That is why timely actions, preventive healthcare is what we stand for. If you feel that yes, अभी थोड़ा ही है और reverse हो सकता है, you should take that action, right? Now I really want to talk about the functional approach. I talked about the conventional approach where we are suppressing the symptoms, or we are going on insulin therapy, or we are going on sulfonylureas or bariatric surgery. This is usually recommended. I won't say, I don't want to really put anything down, but this is how a conventional approach works. But the more solid thing where we are treating the root cause, treating the root cause is the real thing. Treating the root cause, you can really come back to the normal state, to a happy individual, to a healthy individual which you were. without popping any pills, without popping any medications, right? So how do we really work in a functional approach? We understand the severity of your condition. Severity, and we understand the severity by understanding your blood reports. आपकी blood report में what's your HbA1c level, what's the fasting glucose, what's the random glucose, यूरिन में ग्लूकोज पास हो रहा है कि नहीं, फास्टिंग इंसुलिन लेवल्स कितने हैं, ये हम गेज करके वी रियली अंडरस्टैंड, वी रियली गेट इनटू the severity of what is the severity of your condition. Once we understand the severity of your condition, then we take the next step. We want to reduce the metabolic overload. How do we reduce the metabolic overload? We reduce the metabolic overload by ensuring, by making sure that the food that you're eating is not leading to a lot of glucose spike. If the glucose spike after the food that you eat, if the glucose spike is not very high, that means your metabolism or your cells are able to absorb the sugar that is there in your bloodstream, right? आप ऐसा सोचो कि आपका सेल पहले से इंसुलिन रेजिस्टेंट है, ऑन एन एनालॉजी आपका बच्चा ढीठ हो चुका है, अब आप उस पर कितना भी चिल्ला लो, उसको मार लो, पीट लो, कुछ भी कर लो, वो काम अपनी मर्जी से ही करेगा. तो सेम इज द एनालॉजी विद आवर सेल्स. वो ढीठ हो चुके हैं, मार लो, पीट लो, इंजेक्शन लगा लो, गोली खिला लो, कुछ भी कर लो, वो नहीं खुलने वाले, वो शुगर को नहीं एब्जॉर्ब करने वाले. सो वी नीड टू इंश्योर कि अब उसको हम थोड़ा प्यार दें, थोड़ी थेरेपी दें, प्यार वाली थेरेपी दें थोड़ा. उसको बोलते हैं eating nutrient dense foods, preventing a metabolic overload. If we are able to prevent, we eat foods that don't spike up the sugars. We eat foods that do not increase the insulin in your blood. There is no insulin spikes in your blood. तो क्या होगा, आपका metabolic overload prevent हो जाएगा. Okay? और जब ये होगा, then we are able to also enhance the beta cells. होता क्या, धीरे धीरे when a beta cell in your pancreas that is fundamentally producing insulin, when it is exposed to a high glucose environment, अगर ग्लूकोज लेवल्स बहुत ज्यादा होते हैं तो होता क्या, धीरे धीरे उनका फंक्शनिंग ड्रॉप होना स्टार्ट हो जाता है. तो बीटा सेल्स को भी हम रिकूपरेट कर सकते हैं विद टाइम. ओके, तो फंक्शनल अप्रोच का मतलब ये नहीं है दैट हमने फंक्शनल अप्रोच से आए, हमें लगा वी गेट एक्साइटेड एंड वी से कल से ग्लाइकोमेट बंद, कल से मेटफॉर्मिन बंद. द आंसर इज नो. आंसर इज वी हैव टू ट्रांजिशन द मेडिकेशन वंस यू कम ऑन दिस फंक्शनल अप्रोच. वंस यू अंडरस्टैंड द सेवेरिटी, कितनी सेवेरिटी है, कितने टाइम में हम वो मेटाबॉलिक ओवरलोड को प्रिवेंट कर सकते हैं, कितने टाइम में आपके बीटा सेल्स रिकूपरेट हो जाएंगे, उसके बेसिस दैट वी स्टार्ट टू स्लोली रिड्यूस द डोसेज ऑफ द फार्मास्यूटिकल्स दैट यू आर टेकिंग. We start to reduce the dosage of the specific drug that you are taking. That is called medication transitioning. Functional medicine or functional approach जादू की छड़ी नहीं है. It works on logic, and everything that works on logic works at a slow, steady, sustainable pace. And that is why medication transitioning also happens alongside. Okay, I hope everyone understood कि functional approach कैसे काम करती है. Okay, I explained about the blood reports. Once we have the blood reports, we really understand how severe is your condition. जितनी आपकी condition ज़्यादा severe होगी, उसके basis पे like the diet and the food and the nutrition will also be made accordingly, right? The second point that I said, preventing metabolic overload. So this is a slide that I really want to explain, and this also covers like what is our approach. Okay, what is metabolic reboot? Diabetes is a metabolic disorder. All of you would have understood by now. So these are the insulin levels. So insulin कितना जाता है blood में? It is directly proportional to our blood sugar level. अगर आपका खाने के बाद blood sugar level peak spike हो रहा है, तो आपका insulin भी उसी rate पे spike होगा, right? और ये होता है time. So say for example, आप फ्राइडे नाइट है, मस्त मतलब दोस्तों के साथ बैठे हैं, हमने पिज्जा खा लिया. तो what happened? Carbohydrate rich, it led to your blood glucose level spike. It led to your insulin spike. Okay, so there was a sudden burst of energy in the body, but since you are not doing anything, plus the cells are also insulin resistant, हुआ क्या? All the energy that you took, all the energy that you ate was fundamentally deposited in the body in the form of fat. जो love handles आते हैं, थोड़ा पेट निकलता है, थोड़ी arms थोड़े slightly they start to gain the mass. That is the fat deposition that happens because of insulin resistance. But when you eat fats and proteins, when you eat some good food, right? When I say good food ka matlab is not starvation. When someone is reversing his diabetes, it does not mean that he's on this journey of starvation. That means he's eating good food. Good food means that you don't starve, but your insulin spike is low. Insulin spike nahi ho raha body mein. Body has enough time to absorb the elevation in your blood glucose. जितना आपका blood glucose ऊपर उठा है, पहली बात बहुत कम उठता है when you eat more of fats and proteins, foods which are low on the glycemic index. The spike is pretty low, and since the spike is pretty low, the insulin levels are also low, and your cells get time to reboot themselves. Your beta cells also get time to reboot themselves. How do we achieve this? We work on diet modifications that are USP. We work on diet modifications and we deploy precision nutrition. Okay, this is the foundation of a functional approach. Functional medicine ka approach hota hai, food is medicine. So we change the food in such a way that the food is low on the glycemic index. When the food is low on the glycemic index, there will be no insulin spike. Your cells will have proper time to reboot themselves, and we can get rid of insulin resistance. Second thing, we would want to slowly reduce the pharmaceuticals that you are taking. If you're taking insulin injections, it will take some more time to get rid of them because the beta cells have clogged. There is deposition of fat around them, so that time lagega. But slowly we would want to get rid of them because your body is not a dumping ground. ऐसा नहीं है कि जो गोली आई वो खा ली, जो इंजेक्शन आया, जो हार्मोन रिप्लेसमेंट किया वो कर लिया, right? So our body is not a dumping ground. We need to understand the root cause. I hope everyone understands the root cause of their problem. What's the root cause? What's the root cause of diabetes? Once you understand that, then take charge of your health. The next time you go to a medical practitioner, whether you join biomarked diabetes reversal program or not, the idea is not to onboard you on the program. The idea is to educate you. So next time when you are recommended a medicine, you can question on the logic, why is it given? You can question on the logic that how will it help? Whether it is suppressing the symptom or whether it is treating the root cause. Okay, you need to take charge of your health. You need to take charge of your biomarkers. And as I said, we deploy precision nutrition. We would want to avoid foods which are high on the glycemic index that cause sudden sugar spikes. तो अगर हमने ये चीजें अपनी sort कर ली, things will definitely move in a positive direction. Diabetes reversal is possible. It is possible. Reversal can happen. Basic dedication required from your end. जो हम बताएंगे अगर आप वो करोगे, things will happen, right? Insulin resistance can be broken. The excessive overflow of insulin in your body, that can also be solved. Okay, just with basic diet modifications and adding nutraceuticals depending on how your blood report shows up. So it's diet plus nutraceuticals plus home-based workouts or basic strength training. That is what is a functional approach. With this functional approach, we can really help people get rid of the pharmaceuticals or the lifelong medications they are taking. There is a myth कि diabetes हो गया एक बार तो जीवन भर रहेगा. Unless you are type 1, which is very, very less, it's an autoimmune disorder. For 90% people, you do not have to be on medication for life. If someone tells you that, आपका बनाया जा रहा है. You need to understand that as well. Okay. Second thing, right? Progressive fitness, empathetic coaching. This also plays a very key role. ऐसा नहीं होता कि anyone will get diabetic in one day, okay, or anyone will get diabetic in 1 week, okay. It is a progressive thing. आपका lifestyle, आपका environment, everything plays a very, very important role, and everyone needs mentorship. Everyone, सबको हम दुनिया में हम सबको चाहिए कोई राह दिखाने वाला. तो यहाँ पे हम भी आपको राह दिखाते हैं, थोड़ी सी hope देते हैं कि things will happen. While logic, nutrition knowledge, everything is one place, but hope राह दिखाने वाला भी चाहिए. That is why empathetic coaching plays a very, very important role. And trust me, the way our community works at the price point that which we offer you guys, there is no competition. You like go anywhere out in this world, you will not find as empathetic nutritional advisors as we have in our community. Hands down, any day, right? Beta cells can revive themselves. Coming back to the point, beta cells can revive themselves. Your fasting glucose, random glucose, A1C levels, fasting insulin levels can come back in range. Okay, it can happen. It is very much possible. It's about you taking a decision. It's about you taking a step. Diabetes reversal is possible. That is our primary motto, because the common myth is when we were sharing this webinar link all about diabetes reversal, the first question that we were getting is, अरे ये सही में हो सकता है क्या? बिल्कुल हो सकता है और हमने किया भी है, right? That is why we also want to show you some case studies where there was a girl who was taking 2000 mg of metformin in one day, right? Her HbA1c levels were 11.8. There was glucose prevalent in the urine. Okay, urine में blood glucose था. Even she was able to recover from that condition from 11.8 A1C levels to 5.9 in a span of 5 months. I'm not saying diabetes reverse ho gaya, but there is significant improvement. If you see, the average glucose levels are from 291 to 122. This is crazy. This is crazy improvement, right? Like at one point of time, she would be wondering that I have to consume 2000 mg of glycomet for my life, and that might increase to 3000, and then insulin will also come up. And now she is almost off medication. She's not even consuming 1 mg of metformin. Now, that is the power of functional approach. That is the power of a functional medicine approach compared to a conventional approach. So one more case study where the person again was suffering, like fasting glucose was way higher. उसके बाद जो उसका random glucose था वही fasting glucose से कम आ रहा है, right? He is in non-diabetic range. Diabetes is completely reversed here, right? It is possible. We are working with logic, and the best thing is that the webinar is about giving hope rather than explaining the concept. While explaining concept is very important, but it's about giving hope. Things are possible, right? Showing some case studies where people were suffering from comorbidities. There is a condition where the person was suffering from thyroid as well as diabetes. He was suffering from poor glucose metabolism, and here is the person now, like he's now running marathons. Once a diabetic, now a marathon runner, right? Second thing, like and as well as a badminton player, a very strong badminton player as well. The second scenario of a homemaker who was kind of unaware that she's also suffering from diabetes. And that's like we say 77 million people, but trust me, 50% of the people are not even aware that they're suffering from diabetes. And that's the sad story, right? So the first thing, probably everyone should get a blood test done, get a A1C test done, get a fasting, get a random glucose, fasting insulin levels. See, I hope that everyone's taken a screenshot of the optimal range that I shared with you. If not, please you can revisit the recording and check out the ranges jahan pe aapka hona chahiye. So I would now hand over to Chitra. Chitra can take you over through the next steps. I would urge everyone, if any one of you have any questions, मैंने कुछ मिस कर दिया हो या फिर कुछ ना समझ आया हो या फिर इसके बाहर भी आपका कुछ क्वेश्चन हो, please feel to drop it on the chat window. Over to you, Chitra. Chitra, you're on mute.
Thank you. So in case you understand how we can value add in terms of helping you out with diabetes reversal, you can get in touch with the person who invited you to the webinar. आपने जिसकी भी story या जिससे भी आपको invite मिला है, आप उससे एक बार फिर से touch में जाइए. And उसके आगे Biomark nutritional advisors जो हैं आपके साथ एक lifestyle assessment form share करेंगे. Right. This is to understand कि आपका overall बोलते हैं ना दिन भर में आप कैसे कहाँ क्या खाते हो, कैसा एनर्जी लेवल रहता है, उससे रिलेटेड आपके क्वेश्चंस होंगे which you can fill out through our form. Within 8 to 24 hours, we'll be reviewing your case and then we'll revert. And biomarker analysis and in-depth discussion to identify the severity of your case will take place. Because of course, we will not talk in thin air. बहुत टाइम ऐसा होता है कि आपको पता नहीं होता कि आप exactly symptoms क्या हैं. A lot of times people don't really understand how to read their blood reports even. So that is where we step in. We will be responsible for reading it thoroughly and then customizing something for you, which is appropriate for your condition. It's not one size fits all. Once you're on board, there will be regular communication to help you treat the root cause and get your health back. So when I say regular communication, I literally mean 3 times a day, at least every day. That's the kind of commitment our nutritional advisors at Biomark have. When we say we'll really hold your hand through the process, we really will hold your hand through the process. Over to which? Okay, right. This bit. So here's an interesting thing. I have in my family, my father has had diabetes for the past 30 years. And trust me, what we are seeing here in terms of quotation is the bare minimum that we are estimating. So imagine if you're a 30-year-old person, जिसके पास approximately 30-35 साल और है, और आपको एक मेटफॉर्मिन टैबलेट डॉक्टर प्रिस्क्राइब करता है जो कि करीबन 20 रुपए की है, राइट? अगर आप हर महीने पूरे साल 30 साल के लिए इसको कंज्यूम करते हो, तो करीबन 2,19,000 आपका पैसा उसमें एक तरह से इन्वेस्ट हो रहा है। अगर आपको 2 लेने होते एक दिन में, that is 4.5 lakhs a year, right? On top of that, quality of life is poor, right? It's not fun कि आप हर समय दवाई खा रहे हो, अपने आप को प्रिक करके अपना शुगर मॉनिटर करना पड़ रहा है, आपके इतने अपॉइंटमेंट्स होते हैं, मेडिकल टेस्ट होते हैं, and comorbidities are not fun. At a certain age, it becomes very, very, how do I say, threatening. कि किडनी इश्यूज हो रहे हैं, दिख नहीं रहा है, वेट लॉस जब नहीं हो पा रहा है, कोलेस्ट्रॉल लेवल्स बढ़ रहे हैं, हार्ट डिजीजेस बढ़ रहे हैं। सो इट्स नॉट लाइक आपकी लाइफस्टाइल और आपका क्वालिटी ऑफ लाइफ अच्छा हो रहा है इसके साथ, वो या तो जैसा है वैसा रहेगा, एंड इन ऑल लाइकलीहुड इट्स गोइंग टू वर्सन. So let's not buy ourselves into that fate, right? What if we tell you that we can eradicate that very condition of diabetes in less than 8% of the cost? It's about investing wisely in yourself. It's about making valuable health investments. And this is where we come in with Biomark.
Yeah, thanks a lot, Chitra. I hope that like this case study, while it was hypothetical, Chitra had put in a realistic angle to it. And guys, it's actually, I won't say it's also not about completely about the financial part. It's also about the quality of life, right? Uh, we want everyone to live a disease-free life. We want everyone to live a life where they are not worried about something, because if one person gets ill in the family, the entire family is involved, right? So that is the thing that we really want to eradicate. And we want people to be happy. We want people to be healthy, right? We don't want people to be diabetic. We don't want people to live a diabetes free life. We want people to live a diabetes free life, right? So I'll take up the questions now. Chitra, if you have any questions that have come to you, you can kind of share it with me, but I'll take up this first question that is coming from Unni, Unni Kutan. Sorry if I'm unable to pronounce your name correctly, but like I will take up the question. If you're taking insulin shot, it's not effective since absorption is reduced. Okay, I'll take up this question. See, whenever a doctor recommends an insulin shot, that means the जो आपके pancreas में जो beta cells and the beta cells that are in your pancreas that are clogged. Okay, there is a clogging, right? उनकी effectiveness कम हो गई है, तो वो insulin बना ही नहीं पा रहे हैं. At that point of time, you are recommended to add insulin. Insulin shot तब देते हैं जब आपके beta cells insulin बना ही नहीं पा रहे होते हैं, because वो clog हो जाते हैं. But problem क्या है ना, insulin earlier was a last resort. When nothing worked, everything, yeah, nothing worked. I can say जब आप बहुत देर बाद डॉक्टर के पास आए हो कि यार आपको डायबिटीज बहुत टाइम से थी, you were suffering from diabetes from pretty long time, but you were not able to diagnose, या फिर you missed the blood test and all. The last stage was the stage when insulin was recommended. But as of now, insulin is recommended at a very early stage. Insulin is recommended at a stage where uh, people can actually reverse the diabetes. Okay, once you're on insulin injections, it becomes difficult because you are telling your pancreas that we have a alternate source. आप ऐसे सोचो कि आपको आपको जॉब आपकी आपको एक जैकपॉट लग गया है, ठीक है? You have hit a jackpot, and you also have a job. Now you need you're mentally kind of in a state कि हाँ jackpot है, मैं उसका FD करा लूंगा, मेरे को 6% आ रहा है वहां से और मेरा खर्चा चलता रहेगा. I'll be able to like run my expenditures from the FD of that jackpot. I don't need to go to my job. Similarly, for your pancreas also, once it knows that there is a artificial hormone replacement therapy that is coming in, artificial hormones are coming in the body, वो भी relax मारेगा ना, it will stop fighting, right? So that was a last resort when insulin injections were recommended. But as of now, they're recommended at a very early stage because of reasons I cannot openly say. But there is one video by Dr. Hegde on YouTube where he says that insulin is a business. He says, I'm not saying, insulin is a business, and that is what he usually tells, that it is recommended at a very early stage where things can be reversed even with diet modifications. Okay.
There are questions regarding age and diabetes, Shubham. Can diabetes be reversed for people who are above 60 for more than 10 years, so on and so forth, 20 years? Somebody says that age is over 30, over 75. Could we reverse diabetes for them?
Okay. So see, when someone is above 60 years, right? So we can assume, like, so as you have mentioned that the person is suffering from diabetes for 10 years. So there's a significant damage that has happened in the body. There has been damage in the body. Reversal can happen. I'm not saying reversal won't happen, but it will take time. It will take time because when there is a chronic condition, there is not one system that is affected. Multiple systems in the body are affected. So in that case, when we would analyze the blood report of the person, when we would want to really deep dive on the biomarkers, we are pretty sure that it will not be just the glucose levels or the A1C levels. Probably the kidney function might also be impaired. Okay, it might be possible the glomerular filtration rate has dropped. So all of these things we need to take consider before we really can commit that yes, it can be reversed. What we can say for sure that we can prevent the damage further. This is for sure. We can prevent the damage further. We can, if not enhance, we can at least maintain the quality of life the person is living. Okay, so that is what we can commit for sure.
To add to what just Shubham has said, again from personal experience, it's not just about enhancement, it's also about easier management. For a person above 60, for example, in my father's case, it becomes problematic to keep a tab of all the medications that you're taking, the number of insulin doses that you're taking. But if there is any way that through diet that you can help yourself, it's absolute gold. Why? Because my father would use over 60 plus mgs of units of insulin per day, which is a lot. It's a lot for a person to be sitting and injecting themselves like that or having those many medicines. But with the help of Biomark, what has happened is that on a regular basis, he does not have to worry about his, sugar shooting up without taking too much. उनकी insulin consumption कम हो चुकी है. उनका जो sugar का fluctuations थे वो कम होते हैं. Because with diabetes type 2, the problem with plus 60 patients is you never know what happens. रात के टाइम भी वो बहुत ज्यादा डिप कर जाता है या फिर सुबह के टाइम भी बहुत ज्यादा हाई रहता है. So those fluctuations, when they are removed from the picture, you're automatically living a better, more stress-free life. And it improves over time, it's a gradual progress, but it's a very promising one with that.
Definitely, for sure. Because like when we are treating the root cause, when we have figured out the root cause, we understand like what is the real problem. We can pinpoint and we can solve for it, right? And that is the stress that gets released, right? There's a question from Nandlal. Is there obstructive sleep apnea having any relation with diabetes? Sleep apnea has a relation with obesity, and obesity comorbidities have a relation with diabetes. So to understand whether you are in the diabetic range or not, or whether it is just obesity that is leading to sleep apnea, we would recommend to get a blood test done. A blood test will enable us to figure out like what are the biomarkers, whether your biomarkers are in range, and basis that we can take a conscious call on what to recommend and what diet modifications do we really need to recommend to you. Okay. Hitesh says webinar was very informative, and I would love to get in touch with Biomark for sure, Hitesh. Any day we are willing to help people. I'm 37 years old. Last 3 months I have fasting sugar 180. It's a beginning stage. So in this case, what should I follow the routine? What should I follow in the routine? See, while you have mentioned that the fasting glucose above 126 ml per deciliter is an indication of diabetes, we would want to understand what are your A1C levels, and understanding whether you're in a pre-diabetic range or you're in a diabetic range, we can recommend you a solution. We would have a solution in this case that what can be done. Okay, I'm pretty sure abhi sirf 3 months hi hoye hain. It's the right time to take that step, and the flag that we are bearing of preventive healthcare, you can get in touch with us and we can really help you out here.
So there is a question from Mrs. Dipali Hemant Shinde. I think we just covered that. And then post that we have Mr. Divakar Keshri. Me and my father are suffering from sugar. What can I do for recovering from this?
See, for recovery, I hope that everyone understands what's the root cause. Everyone understands it's the problem of poor glucose metabolism. To solve for poor glucose metabolism, the thing that can be done is आपका खाना बदलना है. अगर हमने आपका खाना बदल दिया तो जिंदगी सॉर्ट. प्लेन एंड सिंपल. खाना बदलो, जीवन सुधारो. And that is the approach that we take. You change the food and you are able to live a stress-free, a healthy, happy life.
Is diabetes type 1 reversal possible?
Okay, this is a very good question. Since we did not touch upon this, diabetes type 1 is an autoimmune condition. Autoimmune condition क्या होता है? When your body starts to attack itself. Now there are multiple autoimmune conditions. Hashimoto's thyroid is one. Hashimoto's thyroiditis is one autoimmune condition. Psoriasis is one autoimmune condition. सब में अलग अलग आपकी बॉडी के पार्ट्स और ग्लैंड्स इफेक्ट होते हैं. टाइप 1 डायबिटीज में क्या होता है? द बीटा सेल्स इन योर द पैनक्रियाटिक बीटा सेल्स, those are getting impacted. If we are able to understand the root cause of your autoimmune condition, we can solve for it. There is a way to solve for type 1 diabetes as well if you are able to figure out what is the root cause of the autoimmune condition. It can be poor gut health. It can be the immune borders. Immune borders कौन सी होती है? हमारे GI tract, skin, right? Respiratory, lungs. अगर यहाँ पे immunocomplexes बन रहे हैं, those have settled in your pancreas, those have settled in your pancreatic gland that is leading to autoimmune, it can be solved. But it would need advanced testing to really enable us to understand what's the root cause. जिस भी चीज का हम root cause समझ सकते हैं उसको हम solve कर सकते हैं, right? I hope this answers the question. How would diabetes reversal impact if a person has some other underlying condition? See, whenever in the body, you just consider this thing. Everything in this world is a domino effect or a butterfly effect. अगर एक चीज impact हो रही है तो it will also create an impact on the other thing as well along with it. So if someone is suffering from diabetes and if he has thyroid or if he has a fatty liver, okay, all of these are linked to one root cause, that is insulin resistance. Okay, so if we solve for one, the other automatically gets solved. It's a you can consider it in your mind as a reverse domino effect. Reverse domino effect create करना है हमें, right? What role does stress play in diabetes? If a person is suffering from chronic stress, अगर आपको chronic stress है तो होगा क्या? आपका adrenal gland will release cortisol. Cortisol also leads to insulin resistance. If a person is suffering from chronic stress, अगर consistently he is in a state of stress, cortisol ज़्यादा बनेगा आपकी body में, that will also lead to insulin resistance. So in that case, that is why we said empathetic coaching is very important. Nutrition knowledge is one, but empathetic coaching also goes hand in hand. Both of them work in amalgamation, and that is what leads to proper results. So what should we eat? Any suggested diet? Diet really depends on person to person. On this call, while I can just give a broad recommendation, eat foods which are low on the glycemic index, but what foods to eat for what condition, that depends on person to person. Every body is different. Every person's metabolism, every person's glucose metabolism disorder is different. So we really need to deep dive कि वो suggested diet कैसी होनी चाहिए आपके लिए. I guess I answered this question. How can we know the root cause of type 1 diabetes? It's an autoimmune condition. My son is 6.5 years, few months back diagnosed. Yes. Children are also suffering from diabetes these days. And at the start, we were surprised. But yesterday also I saw a case. There's a nutritional advisor in our team, Mayuri. She brought up a case where a child 13 years old was suffering from diabetes. The HbA1c levels were above 6. Now, while this sounds surprising, but trust me, this is happening because of poor lifestyle habits. Our children do what they see. Our children don't do what we tell them to. If we are snacking 5 times a day, if we are the kind of food that we are eating, if they see, they'll also develop the very same habits. And that is what is leading to these lifestyle disorders, even in children, right? So, but the good thing is that habits can be changed, and habits in children can be molded at an earlier stage. बचपन से उनको mold कर सकते हो अच्छी habits में. But the thing is that it is happening. But the point is, it can also be reversed. Even in children, diabetes can be reversed, and it can happen at a faster pace compared to adults. How much sweetness we should consume, and what is the limit for a healthy body? If we consume more and more sugar, we get diabetic. Please explain. Your body at once can absorb 5 grams of sugar. Anything above 5 grams will get converted into fat. It will lead to insulin spikes. Okay. But as your metabolism, when we say the person has a very good metabolism, he is able to absorb more sugar. That means the muscle mass in the body is the lean muscle mass of the body is really good. Okay. So for every person, this equilibrium point varies. For that, we need to really understand that what is the equilibrium point for you, and after that only we can really come up with the solution, or we can give a proper answer. Okay. And when you talk about sweeteners, I'm pretty sure that you're not talking about artificial sweeteners. Artificial sweeteners are not recommended. Artificial sweeteners, while they say that they are carcinogens, but they are not all are carcinogens, but I can say they're not healthy also. अगर आप उसको कोई आपको बोलता है थोड़ा सा ही डलता है, छोटी मात्रा होती है, the quantity is very less, but if you are habituated to it, तो आप consistently उसको आप लेते रहोगे, and that is something that we would not really want, right? So artificial sweetness should be avoided. Can it be reversed if the person is in an advanced state of diabetes? It can be reversed. You are in any stage of diabetes. Chitra just mentioned her father was taking insulin injections, and that to 60 units in one day. Even we were able to help there as well. Whether a person is in any stage, it can be reversed. What cannot be reversed? If the person is a type 1 and is suffering from diabetic ketoacidosis. उस केस में it is difficult because वहाँ पे तो इंसुलिन लेना ही पड़ेगा. वहाँ पे हम सिर्फ कंट्रोल कर सकते हैं, बेसिक इंसुलिन की यूनिट्स कम कर सकते हैं. बाकी सारे केसेस except this one we can really help. At least we can ensure the quality of life is maintained.
I have a question from Rohit Goyal. How do our cells become insulin resistant with time? What foods are responsible for the same?
Wonderful question. Insulin resistance कैसे होता है? जब मैंने आपको जो फिनोमेना एक्सप्लेन किया था, आपके घर में बच्चा है, आप उसको प्यार से बोल रहे हो नहीं सुनेगा, दूसरी बार प्यार से बोले वो नहीं सुनेगा, तीसरी बार डांटोगे वो सुन लेगा. That is insulin resistance. Your cells also behave the same way. If you are consistently eating sugars आपकी बॉडी में बढ़ते जा रहे हैं, there is deposition of adipose tissue, and if there is deposition of adipose cells on the liver and muscle cells, it will lead to insulin resistance. This is the first part. Chitra, what was the second part?
What foods are responsible for the same of insulin resistance?
Okay. Any food that is high on the glycemic index is responsible for increase in insulin resistance. Any food that gives an immediate spike of sugar, your breads, pastas, even your roti, जो wheat roti आप खाते हो, that is also high on the glycemic index. Okay, it gives a sudden spike of sugar in the blood. That is, these foods are responsible for insulin resistance. And people who are diabetic, I'll just give a free tip here, should not be consuming wheat rotis. Gluten is not good for your beta cells. The gluten that is present in wheat is not good for your beta cells in the pancreas. So जो हमें लगता है कि रोटी चावल खा रहे हैं, घर का खाना खा रहे हैं, दाल सब्जी बहुत healthy है, need to rethink once. It might not be as healthy as we think.
How to maintain good metabolism? My metabolism is very low and I gain weight very fast.
Okay. If your metabolism is very slow, as I explained, the glucose that you are eating, that is not getting inside your cells. If it is not getting inside your cells, there is no ATP production, energy production नहीं हो रहा है. तो जो भी sugar है, वो सब fat deposition हो रही है, and you are gaining weight very fast. You need to break the insulin resistance. You need to eat foods which are low on the glycemic index. You need to allow time for your body to reboot itself. अगर आप थोड़े समय के लिए you eat foods which are low on the glycemic index, so what will happen? Your cells will get time to reboot themselves, and that will help you to improve your glucose metabolism and your overall energy levels. And what will happen? So you'll also see that you start to lose weight as well. Okay. So we'll take one last question in the interest of time. Kindly share this PPT. Yes, like we'll upload this entire recording on YouTube. Feel free to like check out the recording there. So we'll take this last question. So kindly suggest for the working people, 50 to 60 years, who works for more than 10 hours, type of food that do we need to carry a tiffin bag? Interesting question. The conventional Indian food is roti, chawal, sabji, dal. Now, this is the basic conventional food. When the person got diabetic because he was eating this. Now, if the person has to recover from this, the food has to be changed. And for that, we need to deep dive on the medical history. We need to deep dive on what's the routine. And basis that, we would give a recommendation. Okay. So this is how the approach works. The approach is very simple. You reach out to us. We kindly share the link after uploading on YouTube for easy access. Definitely, like the YouTube link will be accessible to everyone. Just you can just search diabetes reversal webinar biomark. You'll find it on YouTube in by tonight. Okay, yeah. So as I was saying, the approach is fairly simple. The approach is you take the assessment form. We would want to understand your medical history. Once you understand the medical history, we would want to adopt a functional approach to help you get rid of the metabolic disorder. Right? That is the approach, and that is what we fundamentally stand for. It's about health educating people. It's about preventive healthcare. Okay, preventive healthcare is what we are trying to propagate. So I hope this webinar was a value add for everyone. At least you got an understanding what the chronic condition is. Having an understanding can enable you to take a step to solve. कई बार क्या होता है we are fighting a battle we don't know, but at least like we got to understand what battle we are fighting. अभी हमें वो fight लेनी है नहीं लेनी, that is up to us, but it is very very important to understand that what battle are we fighting. So that was our purpose, that was that is our vision to enable people, empower people to understand what battle they are fighting, right? So hope it was a value add. Thanks everyone for joining in. We'll keep coming up with such sessions. Okay, thanks a lot guys. Take care. Good evening. Bye bye.